Welcome back to the Ricky Mathews Show from the Citizens Bank Studio. It's Wednesday, the second half of the Wednesday show. So this is the time we have Singing River Health Talk. And I have to tell you, it's been a great opportunity to meet so many dedicated people. And today is no exception. So let me bring in Rachel Kemp. She's the Chief Nursing Officer at Singing River Health System. And you're going to be impressed. She started in August, big announcement around her coming here. But her track record ahead of being here was really, really incredible. And we're gonna talk about her past and what she's doing today, but we're also going to talk about a really dynamic and innovative nursing residency program at Singing River Health System that I think you'll be super impressed with as well. So without any further ado, let me welcome Rachel Kemp to the Ricky Mathews Show. Rachel, how are you?
I'm great. Thank you so much for having me today.
It's a pleasure to see you. So where are you sitting right now?
I'm sitting in my office in Pascagoula at the Singing River campus there.
Good. So listen, you've moved your family here. How is your residency in Mississippi going so far?
So far, so good. I've lived in Memphis since I was 18 years old. So a big change moving from Memphis to the coast. But everyone has just been so wonderful, so welcoming. Really a great start to a new change in life.
Yeah, again, it was very impressive reading about you. Your time in Memphis, you focused on developing as a leader and a manager. You had tremendous skill sets on the front line as a nurse, and then you worked on your education in a very significant way. All of that very impressive. But in a way, it was really a great preparation for what you're doing today. Why don't you kind of give people a sense of your path to Singing River Health System?
So like I said, I moved to Memphis when I was 18, when I graduated high school. I attended then Baptist College of Health Sciences in Memphis to get my bachelor's degree in nursing. Really just fell in love with every aspect of nursing. Giving good patient care is one of the best things that I think you could be doing. Started my career in the operating room as a surgical nurse. Quickly saw that really what I wanted to do with my career was to be a voice for nursing and to be able to help fix things for nurses that really frustrated them on a daily basis, which led me to the path of leadership. I immediately went back after about a year as a staff nurse and got my dual master's degree in both health administration and nursing, and kind of grew through the leadership spectrum as a clinical manager for surgical services and then an administrative director covering all of procedural services, women's services. Had an opportunity to really step up as an interim CNO about 8-9 years ago, and really just fell in love with the impact that you could make from a role like that, as far as helping grow nurses and teach nurses how to do the things that they need to do. Then I took a position in a rehab hospital, kind of switched it up, took care of patients on the front line during COVID, stepped up as a leader and got into staffing with those nurses. Really got a chance to see what was their struggles day in and day out, make those connections with nurses. And that's what I really love to do in my leadership role, is to listen to nurses all day long. What is going on? What can we fix? What can we make better? I took a full-time position after that as an associate CNO for a level 1 trauma center in Memphis, which was a huge learning experience, really expanded my knowledge of the healthcare system. And I was able to build programs like the nurse residency. That same program that I'm building here at Singing River is the same kind of program that I built in Memphis that was extremely successful in helping new nurses incorporate into the healthcare world. And, a lot of my experience was real life learning on the job. And so I really wanted to expand my education as well, and went back to pursue my doctorate in nursing practice, which has really helped me build my practices and processes in quality improvement, and in nursing practice overall.
Yeah. Listen, as a former CEO, I can very much appreciate the fact, you can be a leader, but some of the education you've gotten, and you mentioned it, processes, it's about putting systematic things in place that allow you to measure, that allow you to make sure you're training appropriately, that you're setting goals and then aligning everyone around the goal. It's in the medical field, it can be very complicated. And so having a plan and then managing to the plan and having goals and knowing what your aspirations are. In fact, one of the things I was going to ask you, did you know when you got here that you were going to start the residency program? And you've already answered the question. But a real quick thing, most of the docs that I had the opportunity to visit with, I mentioned that I went to the University of Alabama in Birmingham. They've got a great administration program there. You probably are very aware of it. But I went to paramedic school there. My goal was to go into pre-med, which I did, and then become a emergency room physician. I learned along the way it really wasn't for me. Changed my major and went on to get an MBA, and the rest is history. But I learned a lot, and I became an advanced paramedic in the process. I watched a lot of my nursing friends that I went through these rotations with. When they got out of school, they just got thrown to the wolves. And it's a tough one. I have my daughter-in-law is a nurse, and she went to the University of Southern Mississippi. Same thing for her. She gets out of school, and there's really not a bridge. You go into the job, and it's a big job. From my own experience, I can appreciate what a literal, innovative residency program for nurses to help them really get their feet under them. Instead of taking maybe years to come around, you're able to put in place a very innovative and systematic plan to help them become a confident, caring nurse in what is really a complicated world these days, not just from a drug and patient care point of view, but a legal point of view. And you saw that, and you practiced that in Memphis, and now you're doing it here. You have to have a lot of satisfaction knowing that it's going to help people get off the ground quickly.
Yeah, one of my favorite things is to talk to the nurses when they are that first year out and that second year out, and understand what it was about the program that helped them. One of the scariest times in nursing is your first year of nursing. So you are learning time management. You are learning those advanced skills that you got a little bit of in nursing school, but you just didn't have enough time to practice them. So it's just a really nervous time of life for a nurse. And they have, many studies have found that most nurses quit the nursing field in their first year without this type of support and programs that the nurse residency can offer. Because nursing school gives you a degree, right? And then we have to build your confidence in your practice. That is what this program is all about. And so hearing the feedback that they give is so crucial to building the future of the residency program going forward.
Hey, did you find in your time at Memphis, we talked about a lot about this during COVID, that there was a real need for RNs, and there were a lot of uses of traveling nurses, et cetera. So it was a very dynamic time. And one of the things that struck me, I actually visited the ICU during COVID at Singing River Health System. And one of the things that really kind of touched me was the years of service. How many of the nurses at Singing River Health System had been there for a long, long time? And listen, they had choices to go other places. They had choices to do all kinds of things, but they stayed there. So your experience in Memphis with this residency program, did you find, and do you expect at Singing River Health System with that program that you will actually build loyalty, that there will be a real opportunity for people to say, okay, I get this, and they're really committed to me, and I'm going to stay for the long haul? I mean, that's a part of the challenge, isn't it?
It is. And, Memphis is a great example because there are so many choices of health systems in Memphis. Within the first cohort of this program, we went from like a 46% retention rate of new nurses to a 95% retention rate for new nurses. And it is
Wow.
because you have that support, you have that person that has invested in you. That organization has invested time, mentorship, that dedication to giving you extra education every month that helps you with your hands-on clinical skills. It means a lot to students. And I think what means even more is the way that this program is built. It's not a purchased curriculum from someplace. It is 100% focused on what they tell us their needs are. What do they feel like they didn't get enough of in nursing school? What do they feel like they don't feel confident about when they hit the nursing floors every day? Those are the things that we have built this residency on and that we're so excited to share with these new nurse graduates.
I just took a leap of faith that having a program like this would in fact impact retention, but those numbers from Memphis are very compelling. And it seems to me that when you can offer this, when you hire someone to say, look, we've got this program, this is a reason to join our team instead of maybe somebody else's team. Mm-hmm. What a great selling feature. When we come back, we're going to continue to have our conversation with Rachel Kemp, who is the Chief Nursing Officer at Singing River Health System. We'll see you after this. Welcome back to Singing River Health Talk. Hope you're having a great day. We're visiting with Rachel Kemp, who is the Chief Nursing Officer at Singing River Health System. Just a quick side note, Rachel, my son, Justin, and his girlfriend, Lauren, ran in the New York Marathon this past weekend. And my wife and daughter were up there, and I just got a note from him. They finished and they did really well, had a great time, but they're sore today. They don't need a nurse, but I was worried they might. That's a grueling test. It's not something I'm ready to do myself. Okay, so when we went to break, though, we were talking about this new innovative program that you guys have implemented. It's a nurse residency program. It's a 1-year program. We talked about how it's going to help with retention, that it's a great selling feature when you're expressing to people, nurses, why it might be a good idea for them to come to you in their first year. So let's kind of break it all down. Let's get into some of the basics of why this program, this 1-year program, is a great launch pad for new hires.
So like I mentioned earlier, time management, clinical skills, those are all things that make new nurses really nervous. Most, classical clinical orientations will pair you with a preceptor. You work with that preceptor for probably anywhere from 6 to 12 weeks, depending on your area of specialty. And then you are out in the world providing nursing care. That's really nerve-wracking for a brand new nurse whose major exposure to that kind of area is in clinical, where you are protected under a nursing instructor. And so the point of this program is to really build confidence, add extra clinical skills, and give people a safe place to practice. The kind of things that a nurse resident can expect is starting IVs in the ER under a mentor, being able to talk about situations with their peers, things that they've encountered in the workplace, things that have really scared them, and talk through that in a safe space with an instructor, with a coordinator, with experienced nurses. The focus of this program is on confidence, it's on clinical skills, and it's on critical thinking. But it also provides a lot of professional development. So what do you want to learn in your specialty? Is your goal to be certified in your specialty? We give you the tools and the hands-on training to get there. Singing River also has a really advanced simulation lab at our healthcare academy. So if we don't have the opportunity to be in patients, we have labs that we can take students and residents to, that we can provide those hands-on trainings and skills. it's just a very good program for new nurses to really ingrain themselves in practice, learn from experts, and be able to ask questions along the way. Always knowing who that point person is that they can go to for support and mentorship is something that you don't necessarily find any place that you go to work. And then again, a lot of residency programs throughout the years across the country are based off of a purchased curriculum that is a lot of online modules, things like that. We do it a little bit more innovatively and more tailored to the nursing students. So our goal is to get feedback from the nurse residents. How can we change our practice and our curriculum to suit their needs, to give them what they didn't get in nursing school, and to give them what they are scared of when they go to work every day? How can we make them more comfortable in that practice to provide excellent patient care?
Listen, it's so important what you're saying about the ability to have a culture that is setting up sort of a listening ability, so that they don't have to come into their new job and be bulletproof. They and act like they know what they're doing when there's some aspects of what they're doing that they're not sure about, but they're afraid to say they're not sure about it because they might seem weak or whatever it might be. Every single new nurse goes through the same thing. So having the opportunity to be able to talk to someone and be honest about that, imagine what that does for them, but also imagine what that does for patient care. It's got to be substantial.
Absolutely. And, nursing is an area where mistakes are going to happen. We practice a just culture here where we learn from mistakes. We don't just jump out and punish people for making mistakes. Mistakes are human. And we need to learn from those mistakes so that we can improve our processes and make patient care safe for everyone. The culture here at Singing River also is really unique to me. And coming from another city and other organizations, like just the culture of your teammates that you're going to work with on the unit and in this residency program is unique, because I know people say, oh, well, our workplace feels like family. This really does. That we're taking care of each other just like we're taking care of the patients. You always know that there is someone behind you to help you take good care of patients.
Listen, there is a theme in every conversation I have, excuse me, around patient care and teamwork. There's a team working together. So I think Lauren St. Pei, the CEO of Singing River Health System, and all the leaders of that organization have really done a great job of defining the culture and making sure that it's driven into the organization. And I see it. I see it in all these conversations. I see it in you today. I see it in this new program that you've launched around nurse residency. It's awesome to see. We're out of time for today, but it's been a pleasure to meet you, Rachel.
Same. Thank you so much for having me today.
It's been a pleasure. This has been Rachel Kemp. She's the Chief Nursing Officer for Singing River Health System. Listen, have a great day, and we'll see you tomorrow.